Okay, the geniuses will see us now.
I'm a pro.
He's very unprofessional.
Very unprofessional.
These are our newly arrived surgeons, Doctors Trowbridge and Greenbaum.
Doctor?
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 We're not doctors.
Are you sure they can handle this?
Oh, we can handle it. We're professionals.
You'll forgive us if we're not instilled with confidence.
Potentially unprofessional pieces of content.
So here we go, episode
number 2, baby. Unprofessional.
Unprofessional.
It's officially unprofessional now.
Yeah.
We weren't sure in the last one.
Now we got it.
Our fake names this time. I don't know if we're gonna keep this going, but it is for number 2.
Yeah.
What's
I want to
your
go
name?
with. I think I went with Blake last time. I'm gonna
Yeah.
go with Blaze.
Which, by the way, I was thinking about that, and that's the whitest name of all time. Do you kind of want to be a white person a little bit?
There was a guy in high school that had it.
And he was a cool guy.
And he was Aboriginal, but he was the fastest kid on the track team.
Okay.
And so I always wanted to be as fast as him. So that's where it comes from. Trying to live up to like my childhood, idol.
Aboriginal.
Even though he was younger than me, he was faster than me and younger than me. He beat my like 100 meters time by like 1 second. It was so fast.
Blake. Classic Blake.
Blaze was the name.
Bullshit. His name
Yeah.
is Blaze?
Yeah.
Oh my god.
I don't want to say his last name in case
Well,
there's
that's
one person
probably
listening who knows who that is.
People can just take the fake names we have and then just like link it together to like figure out who we are and where
Yeah.
we're from. like I'm gonna be Kirk Cousins for this one.
No one's ever gonna guess where I'm from. If anyone even ever listens to this, but
I'm Kirk Cousins.
Craig, who's that?
Kirk Cousins.
Who's that?
You're literally wearing his jersey right now.
Oh, this guy. Oh,
Yeah.
okay. The from Minnesota Vikings.
That's right.
player. Okay.
Yeah.
So we're finishing UER, me Pete's, and I don't know. Like I have some of my wisdom that I can impart. But do you want to go
I
first?
feel like acronyms never work, but I'm emergency medicine right now,
Alright.
and then he's in.
Peds is short for pediatrics.
Yeah.
If anyone didn't know.
Yeah.
Yeah. Do you have any crumbs of wisdom you want to impart? Let me start off because I was in in the ER 2 weeks ago. Because I was in pediatric ER,
Yeah.
but like they didn't have anyone, and like what's his face? One of the guys from SGU was in he said we're getting exposed so hard.
There's a lot of guys, okay? Alright.
Don't say his name 2 times.
Oh, okay, sorry.
So he was the resident, and someone else was the attending. And so he's like, do you guys want to see something cool? And we're like, yeah, hell yeah, we do. So like he flipped a coin because there's 3 of us and he did 2. And he's like, okay, you, and so he picked me and someone else. And so we went, and I was like, what are we getting into? He's like, oh, we have a priapism. And I was like, oh, fuck, I have to like touch someone's dick. So anyway, I went over, and like he's like, okay, first what you gotta do is go put ice on it. So like the guy didn't take his pants out. I was like, okay, thank God.
Explain what a priapism is real quick.
Oh.
Nobody knows what that is.
So he like tested me on it too. Okay, it can be caused by 3 things: sickle cell, or sildenafil, or some other drug, trazodone.
Yeah.
And it's like basically there's blood clots in your dick, so it doesn't get soft after, like it gets erect. So if it stays too long, it can cause ischemia and cause like dick death.
Dick death, essentially.
Yeah, dick death. So we're like, we put ice on it. He's like, the guy was like, it's getting better. I was like, okay, maybe I don't have to do anything. But then like 5 minutes went by, and like, your girl, the girl whose name's
Oh yeah.
Stop saying their names. Oh my God. So she came over and she's like, you know what, we're just gonna do it. And I was like, fuck. So basically we had to drain this guy's cock. Not like, the way you think, but man, it was so painful. So she's like, it was so weird. This is why I said she like talks like really professional for some reason. She's like, okay, now just go clean the area. And I'm like, okay. So I'm like, she's like, yeah, you really have to like, cover all the area. And I was like, it's such a weird thing to say. Yeah. And I was like, it was so weird. So anyway, I'm like scrubbing, it is gross. By the way, the guy had like a chancre on the base of his dick. He probably had syphilis or something because it was painless. Whatever, we clean it up. And she's like, okay, now I'm going to insert. She like inserted a needle into like the pubis first to like, numb it or whatever. She put lidocaine in there. didn't do anything. The guy's like, I can still feel everything. And so she like is sticking the needle into like the corpus cavernosum or whatever. And she's like, have you done one of these before?
No.
How'd you get through 6 weeks and you didn't do
I
anything?
never saw one.
Damn, that's crazy. Okay. And like the one that was during your time, I had to do it. Okay. Anyway, I felt so bad for this guy. Like it was crazy. His dick was turning black at the tip, because like it was getting necrosed or whatever, or ischemic. And so like she was like putting it in, and there's so many clots it like wouldn't come out. And so like we get a little bit of blood. She'd have to like take the needle out, put it back in somewhere else to like get more blood. And so
essentially just repeatedly stabbing his dick.
Yeah, it was crazy. Terrible. And like they would like get a clot once in a while, and it would like come faster, but then like clot would come again. So poor guy, they got him like, they took out like a lot of blood, like 50 milliliters, and then it still like wasn't working or something, so they had to send him to urology. But man, it was terrible. I felt for the guy. He was like screaming. I don't know how like the other patients like must have thought we were killing him or something, because like, man. Anyway, that's my ER story. I'm surprised you haven't had a freaking priapism case yet.
No, none. I mean, the only kind of recent thing was like a week ago. We just had a cardiac arrest come in, and all the doctors rush over to it. All the nurses, like everyone stops what they're doing and goes and messes with it because dude's dying. And then, first things first, someone's got to start doing compressions. So I'm like one of the first people on the scene. Someone just started compressions, but they get tired, right? So then I hopped on.
You did compressions?
Yeah, I did compressions. So I'm on this series of compressions with this guy. We just swap in and out. And it's kind of just a crazy experience because we're in this tiny room, this tiny room. And everyone is filled in on this room. And in the middle is this person dying, and you're raised above everyone because you're on this stool to do compressions. So literally everyone's watching you do compressions on this person dying, and you're like, I hope I'm doing these things right. Because not only is this person's life on the line, but people aren't gonna say shit about me. But no, it's crazy. And then you just kind of stop after a while when the doctor's like, okay, I think the person's no longer alive.
Lost him. Damn, I wonder if that was due to your compressions or something else.
And then I'm like, we finish up, right? Everyone kind of, trickles out. And then the doctor starts with an I. She was kind of like the resident. She was kind of like ruling over the whole thing, telling everyone what to do all the different things. And then she sits down and starts like typing or whatever. And I come over and I'm like, she's obviously a little rattled, but I'm sure she's done it before. But I'm like, you good? Like, do you need me to do anything? She's like, just give me a minute, okay? I'm like, okay. That's fair.
Death is so funny, dude.
Yeah, that's dude, kills me.
I can't believe she's like all this fucked up, and she sees it like all the time when you hear and you're like your second rotation.
Yeah. And you're
like, oh, whatever. It is what it is.
Yeah, I don't know. I feel like crazy shit happens in the ER and it's not a big deal. Like I was talking with a little bit ago, and it was like, we saw a person up on a building, and we're like, if that person like fell off right now, I will be scarred for life. If they just fell to the ground to their death, like that'd be the craziest shit. But you see it in the ER, and you're like, all right,
you're like, ready for it, kind of thing. Yeah. I have more peds insights. So, fuck, I can't believe you have surgery next, because peds was hell. There's one doctor, he's like this Colombian guy.
I just heard about him.
Oh, when did you talk to him?
Like 2 minutes ago, before
he's there too?
Yeah.
Oh, okay. He was, I don't know, he's just the worst, and I think he has a personality disorder, because he's like kind of short, and he has like a little man syndrome.
That's DSM-5 criteria.
I don't know what the actual
Low man syndrome.
They might have changed the name, but I'm sure it is. But he's so weird, because like he'll wait until like the end of the shift, and then he'll come and like get us like 15 minutes before we're supposed to go home, and start a lecture on something no one cares about. So one day he came and he asked us like some questions about PDA at 4:45. We're supposed to leave at 5. And so he took us into a room and he started explaining it. 7 p.m. we got out, 2 hours after we're supposed to, because he's lecturing us about PDAs. And then I think he let us go on time the next day. And the day after that, he kept us an extra half hour because he was talking about coronavirus and like how the U.S. hides its data. And I'm like, okay, like how does this have to do with pediatrics? Like, let me go home. But everyone else was like chill. He just made it hell. It was like crazy.
Just because of that, just that end shit. I
No.
thought it was like he was like yelling at you guys.
He was yelling, and
Oh,
like
okay.
the thing is, he wanted to like have a discussion. So I was like, I was talking about like how China probably like hides its coronavirus data. I was like, there's no way with 1 billion people they have like 90,000 cases, and America, even like as bad as they are, have like 200,000 like deaths or whatever, 270,000 for like 300 million people. And he's like, you think satellite data can like miss all these things? And I was like, well, yeah. Like, you're not tracking like there's not gonna be a line out of the hospital like if you're.
Were you actually saying all this to him?
Yeah, I was. But like he wouldn't let me talk. He's like yelling at me whenever I tried to say something. It was so weird. He like wants to frame the argument the way he wants. It's like total little man syndrome. He just like needs to win. He just can't lose.
Well, that's his life, is talking to you medical students at that time.
Yeah,
Like,
he's the
that's-
worst. And he
That's
like
what gets him up in the morning.
he tries to exert his power over. He like takes your hand and moves it around to like where he wants it. It's so weird.
Very strange.
He just like has this like he gets off from like having power over you.
Yeah.
So I wish we had
I know
exit interviews.
exactly the type of person you're talking.
We were supposed to have exit interviews, but like we didn't have them because like the doctor was busy. But I was about to go off on it. I was like, yo, he does not deserve to like be in this position. Like you got to get him away from students. Like he's the worst. And he was bragging about how he punched one of his patients. Patients' dads, because his patients are kids. But yeah.
What is he, Happy Gilmore? I'm the only person to ever take off a skate and try to stab somebody with it.
No.
You ever seen that movie?
Yeah, I've seen it.
Okay.
But I don't remember that. Oh wait, I do remember that scene. It was in early.
He's like all proud because he.
Yeah, he was good at golf though.
Yeah.
I don't know, but besides that, like Peds was good. I would recommend it. Not at this hospital, of course, but
I like the ER at this hospital, but
yeah, because the residents were chill.
yeah, the residents are dope as fuck.
Me, and we were like just talking to them for like the pre-pism we had to do, and like they were super chill. They like
So
introduced
cool.
themselves to us, which no one ever does. Like not even the people in like Peds weren't like introducing themselves. We had to like tell them who we were. So like they're more humble in that. And then they were like helping us. They're like, oh, can you get this? It's over there. And like no one would tell us. They'd be like, get this for me. And then they're like telling us about the patient. They're like, oh, you should go interview him or whatever, get a history. And like they were super nice
Yeah.
compared to like everywhere else.
I just wrote my evaluation form and I was pretty much like, yeah, it was a great rotation, but especially the residents were dope as
Yeah.
hell.
And even the attending, like I don't know what her
I mean,
name
the
is.
attendings are great too, but I just,
Like LP, I think her initials are.
maybe.
No, not her. The other one, the fat one.
Oh, I don't know.
She's there. She was with what's his face, JV. Even though you said it like 30 times,
okay.
that one time at PZR, she was super nice. She took us to do like IVs and stuff. She let us practice on each other. No one had let us do that so far.
You put IVs in your own in each other?
Yeah, so like
What?
like the three of us that were there, we just put it into each other just to like practice.
That's crazy.
She didn't have you do that?
No, my first one was on a patient.
Yeah,
I'm like,
okay.
yo, come here.
Man.
I've never stuck a needle in someone before. Let me try it on you.
And they were chill with that? Did you tell them that?
No, of course not.
Okay.
The fuck?
You never know. There's one PA who's such a bitch. She works on the second floor. She works in fast track. She's like this Indian chick. You haven't dealt with her? She deals a lot with like the ER too, so I don't know how you have it.
Is she like short?
No.
Okay.
She's actually pretty tall. She's probably as tall as me.
No, I've never dealt with her.
So, yeah.
I have a little vague romantic story, I guess. I don't know how to put it. But so I'm in the ED. This was 2 days ago, and I swear, dude, shit comes in waves. Like nothing comes like just one at a time.
I know, I
consistently.
hate that.
Bro, like, and I'm not just talking patients. I'm talking everything. Like every single. I mean this from the bottom of my heart. This is all honesty. Every single freaking girl in that entire ED was like coming onto me in one day. I swear to God, I'm not talking
The
shit.
patients?
No. Like everyone that worked there.
Hmm.
Like for some reason, all the nurses were just extra happy to see me and shit. But then like it just kept going. At one point, one of the attendings, the physicians, I mean, I don't know. She was a younger woman. Like this blonde girl was pretty, and that's the first time I had ever seen her, and she was just giving me the eye. Literally would walk by me and like would keep looking. Like I was like, it's so obvious. I'm like, what the fuck? And then she kept bringing me over and being like, hey, we need a medical student to come look at these X-rays, and then we would just like sit there and do that. I'm just like, what is it? I'm like, do I ask her on a date? What is happening? I'm like, this is so. I'm like, even if I like, I was like, consider what would I do if I did do that, and I just like, I don't know. It just seems like not a good idea.
That's when you ask her for a letter of recommendation rather than on a date. She'd be like, yeah, I'm down.
Yeah, but we have to meet up to do it at my place.
Yeah, well, obviously she has to like get to know you.
Bro, I don't know.
before
I
she
feel
can
like
write.
she was down. Like that was crazy. And then, but then I mean, it was just like everybody. It was insane. The
Yeah.
residents too.
You had your pick.
Resident I was
Yeah.
all over. It was crazy.
What do you mean all over?
I mean, just like, you know, anytime I gave a little to her and gave a little scrap, it was like, all right, here's mine. You know.
You had your pick. What about the patients? Did they ever hit on you?
Usually the older moms. They'll be
Oh.
like, yeah, like I had this 76-year-old Latina
So you mean
woman.
grandma,
Yeah.
not mom.
What?
Grandmom.
I don't know if their kids have kids.
76?
76, yeah.
I feel like if she's a mom, she's
That's a
like,
G-Wagon, I suppose, yeah.
yeah.
But she had like a colostomy bag. But she was like a pretty grandma, alright?
Okay.
Some grandmas are pretty,
you.
okay? But anyway, I mean, that's beyond the point. She was just kind of like, she was just very like shy that I was there. But then like another resident would come by and she'd be like, oh, blah, 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 you know, and then she'd be like, oh. And then she, like, I had to look at the colostomy bag, right, and see like what kind of poop is in there and stuff. And she was just like, no, I don't want you to look. No. I'm like, why? I didn't see. But then Dr. Resident S came by and she was like, oh yeah, here you go.
Oh my god, it's so funny. The stupid thing is like about being a student is that you have to like do all this shit and then like the residents come and do it again.
Yeah.
So it's like they.
But I mean, it makes sense. Sometimes the patient will say something that they didn't say to you, even though you asked it in the same way.
Yeah, that's so annoying. Like sometimes I'll be like, oh, is it pain on one side? They're like, yeah. The doctor comes in, it's like, yeah, it's both sides. I'm like, what the fuck?
I think it's annoying when some of the doctors or residents get mad at the patients for like not knowing stuff or like stopping antibiotics when they should have kept going. Like I get it. We told them, hey, take this antibiotic for 7 days and don't fucking stop.
Yeah.
You will get sick again.
Yeah.
And then they stop when they feel better. But it's like that's how a lot of shit in life works too. Like you do it till it works and then you don't have to do it anymore.
Yeah.
So it's like I don't know.
Patients are just dumb too. Like
They're dumb, but it's not their fault. Like I don't know. Why would they know any of this shit?
we had one lady come in and she like her kid had like parvovirus, slap cheek rash. And then the doctor was like, just take a history. And I was like, okay. And she's like, I was like, so do you have any conditions? She was like, yeah, I have Sturge Weber. I was like, what the fuck? And she was like, perfectly fine. She's like, all I have is glaucoma. Everything else she doesn't have. So I don't know how they diagnosed her with Sturge Weber. Maybe just like genotyping or whatever.
Maybe they just saw some esophageal webs or some shit.
That's not Sturge Weber.
Isn't it? Oh, sir. Oh, that's the congenital one.
Sturge Weber, there's a mnemonic for it. It's like, it's sporadic, port wine stain of the face.
Did she have a port wine stain?
No, she didn't. She only had glaucoma. She had nothing else. And I guess she would have had seizures, but I didn't ask her. But I was like, so what do you have? She's like, oh, I just have glaucoma. And she didn't mention seizures. So I guess she must have been like seizure free or something.
Huh.
Some of the stuff you see is crazy.
Yeah.
Didn't you want to go into ER?
Yeah, I do now. And now I'm like convinced.
What were you like wanting to go before? Like, was there any thoughts?
Well, it was ER number 1, and then it was like everything else. But I guess it was like I was contemplating surgery. I was contemplating internal medicine. I was contemplating family, whatever.
Yeah.
I was thinking like family and then subspecializing in some shit. But
Yeah.
yeah, now it's ER all day, baby.
I think that's what wants to do too.
No, he wants to do IM.
He said, yeah, he said family or IM, but he's like, you know, you can go into family and then do a fellowship in IM and you can actually get paid more than if you just did IM. I don't know, there's like too many complications. But it's whatever.
What other stories you got?
A lot, man. I just don't know. The people you have to deal with is the worst.
What? The
Like
patients or
the students.
Oh, really?
Yeah, they're all so lazy.
Yeah, I've noticed that I definitely have more pep in my step than almost anyone.
It's, I don't know what it is. Maybe it's like school wise or like maybe you get tired as you go on, but like we were working with this one student from another school, a DO school, and she was so lazy, like,
Oh, really?
and I'm super judgmental right now, but whatever.
You're always judgmental.
We were, I don't care. I'm gonna be judgmental. We were working with her. She was like in our group for that like last week, and I had to tell her to do stuff. So like this guy came in and like he had to have like a GnRH stimulation test to see if his like testicles were working. And so I was like, do you want to come with me and like take a history? And like, because she hadn't done one yet, so I had to like ask her to come. And it was like the last day, so I was like, okay, you need to do something at least. So anyway, she came out and I was like, you want to take the lead? She's like, yeah. And so she's asking all these questions, and obviously the main thing is he's here for a reason. He has faulty testicles or whatever the hell.
She was asking just general.
So she asked him like all this stuff, like whatever, like a basic like PMH, HPI, and then she was going on to review of system. She's like going down the list. I'm like, you don't have to ask him all these review of systems. Like, it's not necessary. Like, I get it if it's a tumor or something, like you can ask for headaches, and she did, and she's like, okay, are you like vomiting or diarrhea? Like, okay, any congestion? I was like, what a waste of time. Like, some students just like don't know what to do.
Well, here's the thing. There's usually not knowing what to do and like doing the wrong thing and not correcting it. Like I don't know. Was she more of I just don't genuinely know, or was it like I'm not putting in the effort?
I think it was the effort because this is her 5th rotation.
So it's not the school, right? Because she's DO.
No.
So it's not SGU
but
specific.
I feel like all the DO students I've seen from that school, at least third years, were not good. So I saw this other Asian guy. He would literally hid from his patients. He was so bad.
Jeez.
One guy was not a team player.
There's some weird people going to medicine. There's some weird ass people.
I don't know what it is, but people who just like, they have their own reasons. I don't know what they are. One guy like would steal other people's patients, and it was so weird because like we had decided that like every day we're gonna get there, we're gonna divide up the patients, and then like each person takes one. And he goes and like we divide him, and he like starts going and following the doctor like to other people's like patients, and like what the fuck?
So
like,
was he just too eager, or was he just?
No, I think he got like the doctor shit on him the first day, and
So he's like, I'm gonna be a little bitch now.
yeah, basically, and so he was like just trying to go as much and show the doctor that he's interested or whatever. But otherwise, like before that, he was just like doing Anki in the hallway all day, like 12-hour shifts. He was doing Anki all day. Some people
I respect that a little bit, but
yeah, but like it's clinical time. You should do that at home.
yeah.
He wasn't taking care of his patients before, but then like when like the doctor shit on him, he like started taking everyone else's
Yeah,
patients.
but there's some immature people who become doctors for sure.
One guy was like so set. He's like, I want to do radiology. I really enjoy it. I want to do radiology. And then he took that to be like, I'm not gonna put any effort into any other rotation because all I want to do is radiology.
That's so silly.
Yeah, like
The doctors who I've seen that are the freaking best are the ones who are like, oh, I used to be a surgeon, then I did this, and now I'm an EM. And then you ask them any question, and they're like, brah, and they just spit that out, and you're like, oh, shit.
I kind of want to challenge a doctor sometimes, like the ones that are dicks, but I feel like they know more than I do, so I'm never going to be right.
Bro, there was only one dick in the whole ED as far as doctors go, in my opinion. Everyone else was shows up.
Was he older or younger?
Middle.
I
Bald
feel like
white guy, but he was... But he like at the very last day he finally was like chill with me.
But like I thought you said old white guys like you.
Really?
Yeah.
I don't think so.
Isn't that what you said last podcast?
I don't think so. Old
Yeah.
white guys like me?
Yeah, you're like
Oh, Doctor. Yeah.
yeah, in
Dr.
medicine.
L really liked me. Yeah, maybe.
like we need to get more of you into medicine.
Well, I think so.
Yeah.
Yeah. Oh, yeah, that's right.
We
Yeah,
need
no,
more
I definitely
men.
think so.
More men in
There needs
general,
to be
man.
more white men. In
Yeah.
everything.
Well, let's say men in
In
general.
all positions of power, right, guys? Right, everybody? Don't we think?
No, we don't need to. And dude, this city is making me so racist. I
Really?
probably shouldn't say that on the podcast, but whatever. Yeah, like it's terrible.
Speak your truth, man. Even if you weren't anonymous, you should be saying that.
Like, here's what like the fact of the matter. This is all stats.
Okay.
90% of the homeless people here, what race are they?
Black?
Yeah.
I mean, we have a lot of white homeless people come into the ED.
Oh, well,
Like, mostly, I'd say.
the ones I see, and like so we go to Manhattan like maybe once every like 2-3 weeks or whatever. We always get harassed on the train. Always like, what's her face gets catcalled. Like, it's crazy. And it's always the same. Like, it's never anyone else. Like,
I think that's partially like socioeconomic, and that just happens. To be
yeah, and I'm not saying that it's like,
right.
you know,
but
whatever,
it's
something
it's
ingrained.
making you feel some type of way. I understand that.
And like, what I've noticed is like poverty here is crazy. Like, I definitely want to get out of here as soon as possible. Like after.
Yeah, poverty makes you feel dirty, doesn't it?
Yeah.
I feel like every time you mention like poverty or anything to do with poor people, you like have this kind of like, I'm a little disgusted look on your face.
Well,
like.
okay, because like where I live, it's a lot nicer, and I'd want to like live there again. So
It cracks me up.
I don't know. So like I've had bad experiences. I've never had like, you know, good experiences. It's like always people trying to scam you. Like we were at like a restaurant. Did I tell you about like this chick that came up? We were just grabbing food during our lunch break, and this girl comes up and she goes to everyone in the store or whatever. She's like, "Do you have any change?" And like I never use cash or whatever because I hate getting people come up to me and be like, "Do you have any change?" But he had his wallet open, so like you couldn't say no. So she's like, "Do you have any change?" And so he had a 5 and a 1, and so he gave her a 1, and she's like, "Can I have the 5?" And he's like, "Sorry, I'm a student." He's like, "Please, please, 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 can I have a 5, please?"
No
please,
way,
please."
did he give her the 5?
No, he didn't break down.
Good.
He's like, "Please, please, it's my birthday, please, please." And he's like, "Here, take this." And he gave her like some change, some coins that he had. But stuff like that, it's like, I don't want to deal with that. You
Bro,
know?
have some resistance, man. Have a little
Like,
fucking
I never
correct to yourself.
give
Jesus.
away any of my money because I'm like, yo, like this isn't my money to give. It's loan money. All right, I'm not gonna fucking give you money and then have to pay it off later. But I just don't want to put up with that. It's just stupid. And like, I don't like how the restaurants don't stop it. Like, she came in and the restaurant people didn't tell her to leave. Like, and then you're harassing the customers. It's just weird. I don't know. Do you get harassed?
No. And when I do, I guess get harassed. It's like, it's not harassment. It's someone asks you for money or something, and you just go no.
Yeah.
When you say just like no, like straight up, they don't push you any further. If I have my wallet out and they ask me for something, I'd be like, no, I don't want to.
Yeah.
Like, boom, it's over.
That's the easiest
There's
way.
nothing else to do.
I know. And like, no matter what they say, you can just say no. And like, I had to get used to that. It was really hard because you're like, this person's here, and especially if you have money with you.
Oh, it is not hard.
I know, not anymore, but like before, I was younger and I was like, oh shit, what do I do? You get like in the moment you're flustered.
Naive little rich ass poor people's around.
I don't know what you're talking about. You said my name.
Oh yeah, we'll have to blank a lot of shit on in this
yeah,
one.
this one you can edit. But no, it's like now I can deal with it, but like not everyone is used to it.
Yeah.
Cause like.
No, I mean I don't blame you. I'm kind of just making fun of it because it's funny as hell.
Yeah.
But
But like I traveled a lot, and then like people are like a lot worse off. So you get used to it traveling, and then here it's like everywhere.
yeah,
So
bro,
you
we're
gotta get used
privileged.
to it.
We
Yeah,
got a little privilege.
I know, and it's nothing wrong with that,
No.
but you know you gotta get used to it.
Mm-hmm.
Do you want to wrap it up there?
What time is it? How long have we been in?
30 minutes.
Okay, that's cool.
You gotta go too.
Yeah, I'm gonna go eat some lobster like a real privileged boy.
Where? Well, where are you going?
Claudaddy's.
With who?
It's in like Brooklyn.
Who's that? Oh, you're going.
Yeah.
Okay. You gotta blank a lot of shit in this episode.
Yeah, I know.
Okay.
I don't know how to do that, but
Yeah. Well.
figure it
Till next time. then.
I may accidentally just post it.
Okay. No. How come I'm getting exposed and you're not? We don't want to do that.
I'm saying everything truthfully. I'm being as honest as I possibly can about myself and you.
Okay. Well,
You
let's
just happen to have a lot of shit.
What are you talking about?
You just got a lot of shit.
I don't want
going
people
on.
to think that I'm racist. You know, when I'm
No,
not.
you should be saying what you actually feel all the time, bro.
That is what I feel.
And if it comes out racist, then you should have to explain yourself.
And I don't want to do that.
Yeah, okay, well.
All right. Well, till next time.
All right.